Maverick Physical Therapy. Welcome to a little episode 2 on the Huff, Thuff, Scuff, and Rotator Cuff. In episode 1, we took a look at a little bit on the anatomy, conventional, unconventional, of the rotator cuff. We talked a little anatomy of the thoracic spine and the scapula. We had conversation with regards to how, if you talk about the rotator cuff, you need to also greatly concern in your conversation the hip for the huff, the scuff, scapulothoracic joint, and the thuff, thoracic spine, with regards to that as well. We talked a little bit in regards to what some of my go-tos are in terms of assessment, but then also kind of treatment. So basic stuff which we're going to build on, but for the sake and the purpose of today, I wanted to go after a few more analogies to talk about in regards to preparation of the rotator cuff, what we're looking at anatomy-wise, but then this biomechanical sequencing for this real and this relative motion, in which really we've kind of missed the boat over the years and over time, unfortunately, in terms of our preparation. So it doesn't matter if you like to smash a little racquetball around, beat your friends up with that. If you like to play a little tennis, if you like to play a little dodgeball, like to play a little kickball where you catch and get to throw to bases. If you play baseball, doesn't matter the position. If you like to play a little field hockey, a little lacrosse, a little golf, the sequencing of this is such in that it's this total body load. So my heritage and my roots comes from that of Fremont, Michigan. Fremont, little small town of 5,500 people, home to Gerber baby food. My grandfather back in the day started a farm, which is now Friends Orchards. My dad is the owner. He's 61. He's done it since he's 17 years old. He's forgotten way more with regards to planting than a combination of most any people will ever know together. So the unique thing growing up around my dad, here in front of me I have on our terrain and property here in San Diego, the soil kind of really sucks here. It's like clay, it's like concrete. Growing up around my dad, he was very particular with regards to the seed he used for the quality of the soil, but then the current state of the weather and the current state of the soil. So he was always in tune with, in the springtime, first of all, working up the land, but then also very particular to when he exactly planted these little seeds in the soil to give them the most successful environment to thrive in. But then also he was very much so into collecting samples of his soil and having it be tested for different things, to know what he was potentially deficient in and what he was planting it in to lay out the best blueprint for him to have a successful crop. With regards to that, one thing that I knew was that, man, if you have some really poor soil and some very poor environmental factors, you're not going to have a crop. Fortunately, over the years, he's been super successful with that. In spite of having this very unstable, chaotic kind of ecosystem that we have as humans, and especially back in Michigan, where one day it can be 80 in the spring, the next day it can be 35 with some sleet. So what this means in regards to the rotator cuff, we talked about the fact that it is very significant, but that how, as clinicians, the vast majority of us don't connect the dots pertaining to how the rotator cuff is embedded into this joint capsule. That's this ligamentous structure, the deepest structure within this glenohumeral joint kind of body that meshes within that with the long head of the biceps tendon. We have this massive glob of tissue. We talked about how we have 17 muscles that attach to the scapula. We talked about how this is such a very unstable joint. We talked about the anatomy of that. And in our episodes of the slap tear, we also talked about how the head of the humerus right here, this is basically like a little basketball sitting on a golf tee. So a lot of mobility accessible to this joint, but then also we require a lot of stability three-dimensionally to allow us to consistently and efficiently produce the movement that we want to for the fun that we're having for the sport that we're playing. So my dad planting this stuff, so I'm learning a lot about my soil out here in San Diego. Changes in climate and temperature, it's much warmer, and it's much warmer year-round. So I've got myself some zucchini seeds, some carnival squash seeds, some butternut squash seeds, delicata squash seeds, summer squash seeds, spaghetti squash seeds. Have a big kind of little bank of seeds here, and it really reminds me, so watching my dad and being a part of with my mom and sister over the years planting our garden, but then also watching the crops go into the hundreds of acres of ground that he has, it really reminds me a lot of what the head of the humerus goes through with regards to getting seeded into the glenoid fossa. Fancy word of saying this little kind of shelf, little round kind of bowl-like portion of the scapula that comes together to form this shoulder joint right here. It reminds me of how the interventions, the activities that we engage upon in and use in terms of preparation, preparing the rotator cuff over the years has produced what I called in the first episode this fake stability, this fability, and that we isolate the structure so much that it doesn't matter how good the quality of the soil is around it. If you put a bad seed in the ground, we're not going to bear good fruit. With this fake stability, or with this kind of environment, we also know that we could have the best seed possible, plant the seed, and that because of that poor environment, we'll have no fruit. And to me, what we've done with our Throwers 10 progressions, our Job progressions, and our small rotator cuff like activities from Yoakum, and these guys, again, not to be slanderous to these individuals because they've been very good with their surgical interventions, just not very good and not very keen on the biomechanical sciences and how intervention is going to affect that healing process. And so we could have this very terrible environment, meaning, hey, I could have terrible hip mobility, I could have terrible scapulothoracic mobility, I could have terrible thoracic spine mobility, stability and strength throughout all these features, and yet I could have very strong or very stable, whatever you want to call it, rotator cuff-like structures, these four little guys, but yet have all these shoulder-like pathologies, these tendinopathies, this tendonitis, progression to tendinosis, which progresses to some form of partial tear because of this reactive disrepair, this degenerative like tendinopathy that spans from a reduction in vascularity and neurovascular like function. Very, very important that we have this optimally prime environment to seed the head of this humerus into the glenoid fossa. Because again, it doesn't matter how cute and fancy these little exercises are. If we're really missing the boat and not including the whole gamut of things, kind of this whole spectrum of things together, we will 100% not bear good fruit, because the authenticity and the genuineness of the biomechanics required for our function, our sport are, we're unprepared to participate in that, to be consistent and efficient, short and long term. Our seed analogy. I also have another little analogy. So my little guy Maverick, One of his favorite books, man, he is, since he's been a little squirt. He's 2.5 years old to be 3.